Travel nurses have been around since the late 1970s. According to travelnursing.org, the first modern travel nurses responded to an influx of patients during a Mardi Gras celebration in New Orleans in 1978. The need for travel nurses resurfaced again in 2020 with the COVID-19 pandemic. Even though demand for travel nurses has decreased, they still play a vital role in patient care.
But some argue this more expensive temporary labor is putting a Band-Aid on a much bigger problem that needs a more permanent solution.
Come on, Franny.
This 25-foot camper is Karen Cothran's home away from home.
Go potty?
She and her dog Francine have a family back in Shreveport, Louisiana. But for now, they are hundreds of miles away in Liberty, Missouri, where Karen works as a travel nurse.
So travel nursing was something that I said I would never ever do because I am such a homebody.
But when the COVID-19 pandemic hit,
it really kind of exploded. And so then you really started hearing about travel nursing.
The need for travel nurses, considered emergency or temporary labor, skyrocketed as critically ill patients flooded hospitals across the country.
I did it and I loved it. I met some amazing people and they made my first travel experience just wonderful.
But she admits the lifestyle is not for everyone and the learning curve is steep. As she says, travel nurses are forced to learn new procedures and meet coworkers over a matter of days versus the months of a traditional orientation.
Been now a nurse for 9 years.
Travel nurse Jennifer Donkos says there were financial benefits to traveling during COVID, but they came with a price.
It is strictly work, maybe eat and sleep. So there were some things given up of being able to do these extra things like paying off a house, paying for someone's education, getting out of debt.
But the ups and downs of travel nursing hasn't slowed its growth. A report released in February of 2023 by the American Hospital Association reveals the number of hours worked by travel nurses in hospitals grew from less than 4% pre-pandemic in 2019 to over 23% in 2022. That increase in travel nurses has impacted the healthcare industry. Trisha Guidry is the Chief Operating Officer at Baton Rouge General's Mid-City campus.
How do travel nurses affect your bottom line when it comes to those salaries?
So when you look at travel nursing, of course, it is much more expensive than those who are coming on full-time and part-time. What happens is your margin unfortunately shrinks, and not only do you see the increase in labor costs, but you see the increase in supply costs.
Along with the increase in the number of travel nurses, the Journal of American Medicine Network said in 2021 alone, more than 100,000 registered nurses left the labor force. A shortage that hasn't gone unnoticed by U.S. Senator Bill Cassidy from Louisiana, who's also a physician and ranking member of the Senate Health, Education, Labor, and Pensions Committee. He's leading the charge in Washington to ease the nursing shortage by highlighting government red tape that creates delays for immigrant nurses to come to the U.S. and work. Cassidy also sees promise in upskilling, training medical assistants and licensed practical nurses to become RNs. And he said he wants to provide federal funding for state nursing certificate programs.
One, if you have a nursing shortage, if we have an emergency, we're less likely to find an empty bed for us to get into. But if we're paying the bills, whether it's the business owner or the individual, the bill is going to be that much higher because they've got to cover those extra costs.
So increased labor cost is eventually passed over to the customer.
Absolutely. It's an input to their operation and they're going to pass it.
Cassidy says that cost gets passed along to patients in the form of higher out-of-pocket cost, higher insurance premiums, and limited access to quality care. Guidry says her goal is to establish a culture at BRG that encourages nurses to stay for the long term.
People want to work somewhere where they feel like they can be their best self, right? They can come to work and give 100%, and that they have a feeling of truly belonging and being heard.
In a perfect world for you, what would it look like here at Baton Rouge General?
So in a perfect world, we wouldn't have any nursing openings. We could decrease the amount of agency and external contracts you are utilizing. You know, when you think about a culture, part of that is ownership. right? You want nurses here who have ownership in what you do and the culture that you have established here to continue that.
While the cost of temporary labor and higher staff nurse salaries have strained hospitals, more money has helped workers like Karen, who got into nursing in her 30s, meet her financial goals, such as paying off her student loans and saving for retirement.
This helps me kind of try to put this nest egg back for later in life. And I know I'm only 45 years old, but you know, time goes by pretty quick.
So for now, home is where the work is.
I'm having fun out here doing what I do. I enjoy my job. I enjoy the people that I work with, and that makes it so much easier to keep doing this. So who knows?
To cut costs, some healthcare systems across the country are rethinking how they utilize travel nurses. In June of 2023, St. Peter's Health Partners in New York said it would stop hiring travel nurses who live within 50 miles of Albany. In a statement to the public, the hospital said, quote, "It's now time to move away from external contract labor so we can reinvest in our core staff."